BSI. So I'm safe, my partner's safe, my patient's safe, and the bystanders are safe. So the scene is safe. There appears to be no environmental hazards, so there's no animals running around, nor is there any traffic. I'm only treating one patient today, and it appears to be a nature of illness because I don't see any trauma. There's no need for additional resources, so I don't need an ALS crew. There's also no need for C-spine, extrication, or specialized equipment, nor would I need any additional resources because it appears the problem is just trouble breathing. So my general impression is that she's conscious, which is a good sign, and she's having trouble breathing because she's in the tripod position. And there appears to be no life threats because there's no open wounds, so she's not bleeding. And the only life threat possible is that she can stop breathing. So, hi ma'am, my name is Denise Garcia. I am an ENT. What is your name?
My name's Ariana Jones.
And what seems to be the problem today?
I can't breathe very well.
And where are you?
ABC.
What day is it?
October 5th.
And can I treat you?
Yes.
Okay, so my patient was alert because when I walked into the room, her eyes were open and she was following me with them. And her airway is clearly open because she talked to me. Now I'm going to assess breathing, which is BERT. So her breathing, her breath sounds, I hear a wheezing sound. Clearly she's it's taking her effort to breathe. The rhythm seems regular. The rate seems regular as well. And the rate is more than normal. Okay. And then the tidal volume is inadequate. So now circulation would be, her skin is pink, warm and dry. She does not need a capillary refill because she's not under the age of 6. There's no bleeding, so there's no need to stop anything. Now we'll be taking her pulse, which is right here, and okay, so for is 72, so her pulse rate is normal. So there's no disability. The deformity is that she's in the tripod position. I'm going to expose her aerial complaint, which is her chest. My plan, to formulate a plan, I want to go sirens on in my ambulance. So that's how I'm going to take her to the hospital. I don't need an airbag. Ma'am, what were you doing when the pain began?
My homework.
Does anything seem to make it better or worse?
Maybe an inhaler.
Okay, can you describe the pain to me?
Sharpish.
Okay, sharp pain. Where is the area? With one finger, please point to it. And does it seem to spread anywhere?
Mm-mm.
Have you ever felt this pain before?
When I had an asthma attack.
Okay, and then so on a scale of 0 being no pain to 10 being the worst pain you felt, can you rate your pain?
It's a 4.
And then what time did the pain begin?
About an hour ago.
Okay, so is there anything else that you are feeling?
Dizzy.
Okay, so her being dizzy is a symptom because she had to tell me. There's no other signs. Are you allergic to anything, ma'am?
I'm lactose intolerant.
And are you taking any medication?
Does an inhaler count?
Yes, it does. When we go off to the hospital, I'll make sure to bring her inhaler with us. And you said you had an asthma attack before, right?
Mm-hmm.
So that would be her past history, that she had an asthma attack before. And what was the last thing that you had to eat or drink?
Chocolate.
And again, can you tell me what were you doing when the pain began?
My homework.
So what is your legal sex?
I'm female.
And what is your age?
I'm 18.
And what is your weight?
110 pounds.
Are you smoking?
No.
Do you drink any alcohol?
No.
And do you take any recreational drugs? No, okay. So now I'm going to assess her vital signs. And her skin is still the same, so it's pink, dry, and warm. Her pulse. So there has been no change to her pulse rate, rhythm, and quality. It's still 72, strong and regular. She doesn't need a capillary refill because she's not under the age of 6. Nor does she need her temperature taken because she's still great. She's older than 6 years old. Do you feel any pain, ma'am? Okay, and then I'm going to assess her breathing one more time. So her breath sounds appears to be the same, so wheezing sound. It's clearly still taking her effort to breathe. Her rate is still the same. It's greater. It's more than usual, so 30 breaths a minute. Her rhythm is regular, and her tidal volume is inadequate. So I'm going to assess her neurological. I'm going to perform a neurological assessment. So on the Glasgow Coma scale, I'm going to give her a 14 because when I asked her the ANO times 3 when I was establishing a patient rapporteur, she said it was October 5th, but today is the 8th, so she clearly seems to be confused. And then I'm going to assess her pupils. Okay, alright. So her pupils are pearl, so they're equal in roundness and they react to light. PMS, which is so can you move your legs and arms? So and do you feel this? Mm-hmm. And then do you feel this? Mm-hmm. Okay, so PMSS checks out. Okay, so in the LA County, I will be checking for ANO times 3 here, so I will do that once more. What is your name?
Ariana Jones.
Where are you today?
ABC.
What day is it?
October 5th.
And why did you call us here?
Because I couldn't breathe.
Okay, so my patient seems to be, she appears to be stable, and I will be assessing her vital signs every 15 minutes.